Goran, what are the benefits of digital tools for the prosthetics workflow?
So we are observing in the past years, thanks to the introduction of new tools for CAD design and dental laboratory, that there is a huge potential for the increase of the efficiency, which means that it becomes much more simple to design different versions. The procedures becomes faster, more efficient, and this has repercussions to the reduction of the prices. So again, just to summarize it, is the increase of the efficiency in particular.
What are the consequences in surgery, in implantation?
So probably the digital workflow in implant dentistry started with the surgical parts. Actually, we have the tools for the 3D implant planning since many years already, so probably around 10-15 years. The digital planning in implant dentistry for surgery is based on the use of 3D radiographs, so which means either CT or today cone beam CTs, which are associated with a higher doses of radiation, and therefore from the medical point of view, from the ethical point of view, so we as doctors, I think we are obliged to set the indication, the correct indication for the use of cone beam CT. And probably the two most important type of patients are which are in need or really benefit the most from the use of cone beam CT and 3D digital implant planning are the situations with basically large gaps, or many teeth are missing on one side, and otherwise complex cases with large bone defects, in which the cone beam CT helps not only to place the implant in the correct position, but to do the correct treatment planning.
Now let's talk about end-to-end comprehensive digital workflows. What is the role of interfaces and interoperability?
This is a very good question, and also here I think every technician, every clinician in the past years in a lot of moments was frustrated because we have very nice tools, very fancy tools, but when you really have to treat the patients from the beginning to the end, then we realize that very many interfaces are not really open. And fortunately, the companies are, getting together, are collaborating together. So what is happening today, we are seeing the first really overall digital workflow. So basically from the planning, so from the start, from the planning up to the prosthetic reconstruction. This is important because only through the use of a comprehensive digital workflow, you're going to be able to really take out the maximum of the benefit of the digital workflow. So we have to think about the entire treatment, not just the implant or just the crown.
Is the 3D virtual patient playing any kind of a role as of today in daily practice?
I would call it this is new music of the future. We have the possibilities, the tools are there. So maybe you're thinking about the possibilities of taking the 3D face scanners, the so-called concept of virtual patient. So this can be done. But matter of fact is that there are no really softwares which are really mature enough to do this in a predictable way. As a consequence, we are not really doing this in a daily basis. So which means here we need some tools again from digital to come back to the real world, really to try it in a patient. Anyway, there are interesting startups, interesting companies, many examples. I'm going to make names here, not to favor anybody. So they're interesting concepts, and I think within a few years we're going to see really very interesting tools for the implementation of the concept of virtual patient and also of the augmented reality.